Hello, my name is David Strayer. I'm a professor of pathology at Thomas Jefferson University and Thomas Jefferson University Hospital and the Sidney Kimmel Cancer Center in Philadelphia. I'm the principal editor of Rubin y Strayer Patología, which is a textbook that is intended to teach pathology to aspiring physicians and people in medically related fields. Our textbook aspires to teach diseases, to teach you how a disease develops, how it evolves, and how it affects patients with and without treatment in the course of their disease. To this end, 55 physicians from all over the world have contributed to help provide you with a background so that you can understand and treat patients more effectively. We believe in an integrated approach to patient treatment and to understanding disease and medicine. As a result, we have three basic sections in our textbook. One of these is the fundamental mechanisms of disease. One is how diseases affect the whole body. And the final section is how individual organs and systems may be affected by particular disease processes. The first section is the foundation for everything that follows. It describes the basic disease processes as they evolve and as they affect human beings. It includes vivid illustrations of line drawings and photographs that provide the illustrative substrate for people to understand disease. The parts of this section include cell injury and cell death, inflammation, wound healing, pathology of immunologic diseases and basic immunology, cancer, genetic and developmental diseases, diseases that affect hemostasis and the distribution of fluids within the body, the effect of the environment on human health and disease, and finally, infectious diseases and the organisms that cause them. The second section of the book is an integrated section that provides a degree of insight into processes and diseases that affect the whole body, so as not to separate out individual organ systems, but rather to get an overview from a distance, as it were, so that one can appreciate the magnitude of the effects of these processes. Topics that are covered in this section include pregnancy, aging, diabetes, sepsis, autoimmune diseases, and amyloidosis. The third section of the book involves a discussion of individual organs and organ systems and how they are affected by the diseases that impact on them. It entails a discussion of their clinical presentation, how these diseases evolve in a patient, how a pathologist sees pathologic specimens from these patients, biopsy specimens, surgical specimens, grossly and microscopically. It also includes a section on forensic pathology, which takes pathology outside of the realm of patient care and focuses on its intersection with the real world. Our approach in this book is highly visual. We have hundreds upon hundreds of multicolored pictures and many line drawings that are intended to show what we see as pathologists, that are intended to illustrate how diseases evolve and the many ways that they may present. We also try to provide for aspiring physicians and people in medically related fields an understanding of what these diseases do to and about patients, so that they can appreciate the extent to which they are focused on conquering disease. People who are training to become physicians and people who treat patients in other medically related fields understand that disease is their enemy. In this struggle, we can only prevail if we understand our adversary. Therefore, we try to teach pathology to these people so that we can lay a foundation which will allow them best to evaluate the patients that they see and how to proceed with their diagnosis and treatment. No two patients are alike. Medical professionals have to learn how to evaluate and treat patients based not on what 90% of people with a particular presentation have, but based on what that patient has. This can only be done if you understand the complexity and the diversity of disease, and if you understand the strategies that diseases use to evolve and circumvent our therapeutic interventions. That allows you to decide how to best treat the patient and how to best evaluate the patient. Our book opens a door. This door looks out on the world of disease, and is intended to provide all aspiring physicians and people in other medically related fields with the information they need to deal with patients and to grow. You will never know everything you need to know, but we try to help you build a foundation so that you can understand what you need to know today, and to build on that foundation so that it can continue to grow and that your medical knowledge can adjust to changing knowledge of disease in the future.